Okay, great auricular nerve, that is C2, C3. Okay, then you have auriculotemporal nerve, that is from trigeminal, that is this part of it. Then you have vagus and cranial nerve 7, that is facial nerve. Facial nerve and vagus nerve inside. Okay, so same thing behind they have mentioned here, vagus and facial nerve. Here you have the great auricular nerve in the purple, and then you have the lesser occipital nerve. So how many words it became? More than 5? 1, 2, 3, 4. Oh, 4 words. Very good. Come on.
Surface of the pinna. Okay, it has a few elevations and a few. How do we remember it? We remember it. It is a bit complicated, so it's better to use a mnemonic. I like this Afghan, AFGAN. So you can remember the nerve supply of the lateral surface of the pinna by the mnemonic Afghan. A stands for the auricular branch of the vagus, F stands for facial nerve, G stands for greater auricular nerve, and AN stands for the auriculotemporal nerve. Okay. So what are the areas these things are supplying? Always remember this auricular branch of the vagus and the facial, they tag along. Wherever they go, they are like friends. The facial and the vagus tag along wherever they go. So they will continue to supply the external artery canal, and they will continue to supply the tympanic membrane lateral surface. So they tag along. So till the tympanic membrane. So they are like friends. Okay, facial nerve, we have 4 friends. Fine. So, what does this duo of auricular branch of the vagus and the facial supply? They supply the Simba concha. So, this part that we see here is supplied by the cranial nerve 7 and 10, that is the auricular branch of the vagus and the facial nerve. Okay, the rest of it, that is the posterior part of the helix, and the anti-helix is supplied by the greater auricular nerve, C2, C3. It is supplying the greater part, almost entire part of the lateral surface of the pinna. That is why it is greater auricular nerve. Okay, this part you can remember it, auriculotemporal. Auricular means ear, temporal is the temple area. Okay, so it is coming from there. It is obviously derived from the mandibular division of the trigeminal nerve. So what does it supply? It supplies the ascending limb of the helix. This one, ascending limb of the helix. It is supplying the tragus. It is supplying a part of the Simba concha, the most anterior part of the Simba concha, and a little bit of skin in front of the ear. Okay, this is the nerve supply of the auriculotemporal nerve. Now, I want you to remember one important part, that this is the external artery canal. What is the nerve that is supplying the posterior part of the external artery canal? The duo of the auricular branch of the vagus and the facial. What is the nerve supply of the anterior part of the external artery canal? Is supplied by the auriculotemporal nerve. So remember this relation. It will be helpful. We go further. So what is this? The nerve supply of the medial surface of the pinna. Nerve supply of the medial surface of the pinna we can easily remember by the mnemonic AFGLO. AFGLO. AF again, they are the duo, the auricular branch of the vagus and the facial, they are the duo. They are supplying the post-auricular groove. This part is supplied by the auricular branch of the vagus and the facial nerve. They go together wherever they go. Okay. The rest of the almost entire part of the medial surface of the pinna is supplied by the greater auricular nerve, because again the greater, so it is supplying most of the medial surface and most of the lateral surface, except the most superior part, which is supplied by the lesser occipital nerve. Another tip for you to remember, basically both the medial surface and lateral surfaces, there are 3 areas. So here you have 1, 2 and 3 areas, and it's supplied by 4 nerves. Again, auricular branch of the vagus facial forming a duo, greater auricular nerve and lesser occipital nerve. Okay, even on the lateral surface also you have 3 areas and 4 nerves. 3 areas are most of the pinna, that is the posterior part of the helix and the lobule is supplied by the greater auricular nerve. The anterior part, the ascending crest of the helix and the tragus is supplied by the auriculotemporal nerve, is the second nerve, and the Simba concha is supplied by the duo of auricular branch of the vagus and facial. Okay, now we have completed the lateral surface and the medial surface. Now coming to the nerve supply of the external artery canal. So, as I said, when you have this external artery canal, the anterior part, that is the tragus, this is supplied by the auriculotemporal nerve. The posterior part, what is the relation? That is the cymba concha, that is supplied by the auricular branch of the vagus and the facial nerve. So these are the same things that continue inwards. Okay, so the anterior wall and roof of the external artery canal are supplied by the auriculotemporal nerve. The posterior part and the floor, the posterior wall and the floor are supplied by the auricular branch of the vagus and the facial nerve, the dio, which again travel together. Okay, so if you want to go a little bit more deeper, the superior part is supplied by the facial, and the inferior part is supplied by the auricular branch of the vagus. Right? So now coming to the applied anatomy, when we use a earbud and try to clean the ear, we get cough sometimes, and that is called the cough reflex, and that is mediated by the vagus nerve, because this is supplying the external artery canal and this is also supplying the larynx. Okay, now coming to the tympanic membrane, nerve supply of the tympanic membrane. Tympanic membrane, as you know, has a lateral surface and a medial surface. Okay, the external artery canal anterior wall is supplied by the auriculotemporal nerve. There is the same nerve that is supplying the anterior-inferior part of the tympanic membrane. Auriculotemporal nerve derived from the mandibular division of the trigeminal nerve. The posterior superior part, what is supplying the posterior superior part? Superior part is supplied by the facial and the inferior part is supplied by the vagus. The same vagus is supplying the posterior superior part of the tympanic membrane lateral surface. Note that this is where the dio break up. Okay, dio break up and the vagus continues forward. This is just a way for you to remember things. Okay, so the nerve supply of the tympanic membrane lateral surface, anterior inferior surface by the auriculotemporal nerve, posterior superior by the auricular branch of the vagus. Okay, now we have covered the lateral surface. Now nerve supply of the tympanic membrane medial surface. Entire middle ear is supplied by the 9th cranial nerve, that is the glossopharyngeal nerve. There is a tympanic branch of the glossopharyngeal nerve. So this is a tympanic branch of the glossopharyngeal nerve. So this is where it is coming. This is basically a picture of the medial wall of middle ear. Okay, medial wall of middle ear. It is quite complicated. Let us not go into this now, but for you to remember the nerve supply of the medial surface. So this is a tympanic branch of the glossopharyngeal nerve. So this forms the tympanic plexus. So this is also called the Jacobson's nerve, right? So this supplies the medial surface of the tympanic membrane. Now the applied anatomy point is, sometimes a patient comes to you, he says, I'm having ear pain. Okay, you look into the external artery canal, you look into the tympanic membrane is fine and intact, external artery canal is normal. Then you check the tonsil of that side, you find it congested edematous. So sometimes if the infection is really high, pain from the tonsil is referred to the ear. This happens because both of them are supplied by the glossopharyngeal nerve. Thank you for the patient listening.
Nerves, which involves the 5th, 9th and the 10th cranial nerve, and the C2 and C3 nerves to the ear. Now these nerves also have varied supply to other regions as well, and this common supply is responsible for the Reffered pain that is seen in ear. Now what are the causes of Reffered pain in ear? First can be Reffered pain via the 5th cranial nerve or the trigeminal nerve. This involves dental, oral cavity and TM joint causes. So dental causes can be caries, tooth, impacted molar, malocclusion of teeth. Causes in the oral cavity involves benign or malignant ulcerative lesions, and temporomandibular joint problems involve Costin syndrome, TM joint arthritis. So these are all the causes that can cause a Reffered pain to the ear via the 5th cranial nerve. Next is Reffered pain via the 9th cranial nerve. Now the 9th cranial nerve, it supplies the base of tongue as well. So in case of base of tongue malignancy, there can be a Reffered pain in the ear. In oropharyngeal causes like acute tonsillitis, peritonsillar abscess, benign or malignant ulcers or soft palate or tonsils. It is also seen in Eagle syndrome. Eagle syndrome is basically when there is an elongated styloid process that compresses on the 9th cranial nerve and hence causes pain, Reffered pain to the ear. So these are the causes of the 9th cranial nerve. Next comes referred pain via the 10th cranial nerve. Now these causes include laryngeal causes and thyroid causes. Laryngeal causes can be TB, carcinomas, ulcers, etc. Whereas thyroid causes can be acute and subacute thyroiditis, Hashimoto thyroiditis. So these are causing referred pain via the 10th cranial nerve or the vagus nerve. Next is referred pain via the C2 or C3 cranial nerve. Now C2 C3 cranial nerve causes pain in cases of cervical spondylitis, in Carey's spine. These are the causes where it will cause referred pain as well in the ear. So now this is a precise chart here which gives you all the causes and all the causes of the pain in referred pain in the ear, as well as which are the nerves involved in each of these causes. So it can involve the tonsil, parotid, thyroid, larynx, styloid process, oral cavity, TM joint, nerve origin, and spine. And all of these are either via the 5th, 9th, 10th cranial nerve or the C2, C3 cervical nerves. Now, the neoplasms which can cause referred pain are pyriform fossa, glottis and supraglottis CA, post-cricoid CA, posterior pharyngeal wall CA. These are all via the 10th cranial nerve. Posterior 1/3 of the tongue is via the 9th cranial nerve. Parotid and the nasopharynx. Coming to common causes of referred pain, even out of all, Carey's teeth impacted.
Acted wisdom teeth, caries, infant teething. DMJ, temporomandibular joint disease. Tubal area, eustachian tube dysfunction, nasopharynx, area behind the nose, rule out tumor. Tonsils, infection, tumors. Throat, infections, tumors of pharynx, larynx, voice box. Tongue, inflammation, tumor. Trachea, windpipe, larynx, voice box. Thyroid gland, infections, tumors. Temporal arteritis, inflammation of the artery above the ear.